Irritable Bowel Syndrome. In short, it is called IBS. What is IBS? Bowel gets irritated. Why? Your mind gets irritated. So it is a big term involving the bowel. When the cause is not known, usually they give a name syndrome, irritable bowel syndrome. So when a person catches this term, when he is diagnosed with the irritable bowel syndrome, that goes to the mind, he goes on thinking about that only, he feels the symptom. What is the symptom? The moment he takes the food, he feels like going to the restroom, toilet. He has to evacuate the content of the large bowel. Because he has to evacuate the content of the bowel immediately after taking food, cause is not known. It is called irritable bowel syndrome. For all these causes, one term is called syndrome. But how to treat these cases? So many people are suffering from irritable bowel syndrome because it is there in my mind, because it is there in the mind of the person. Once he is identified with irritable bowel syndrome, whenever he takes food, he feels that he has to go to the restroom, definitely. But what I do, I usually counsel the patient. I said, forget the term irritable bowel syndrome. Why you are getting irritable bowel syndrome? Because you have got the anxiety. After taking food, irrespective of what work I am doing, I have to go to the toilet, evacuate, then only I can resume my work. So, any anxiety causes malfunctioning of the Manipura chakra, which is associated with the stomach. Stomach is getting filled with the food. The moment it gets filled with the food, Manipura chakra, because of his anxiety, Manipura chakra starts malfunctioning. Immediately, not retaining the food for 2 hours for digestion, immediately it goes to the small intestine, large intestine. Then he feels like going to the toilet to evacuate the content. See, these are all psychological problem. He feels that he has to evacuate the content immediately after taking food. When you take food, the stomach is in the form of a bag. It has the capacity to retain the food for digestion, or at least for some time, merely more than 1 hour up to 2 hours. Then it goes to the small intestine for assimilation of the nutrients. Then it goes to the large intestine, maybe after 3-4 hours, 5 hours. Next day only he has to evacuate. Immediately after taking food, he feels like. So the mind actually is responsible for bowel movement because it is affecting the proper functioning of the Manipura chakra, which is responsible for retaining the food or not retaining the food. So I usually say, forget the word IBS. Then you just take some important project before you take food. Then when you are taking food, you will be thinking about the problem which you have to face immediately after taking food. Then you will not think about the restroom at all. So you have to counsel your mind. Then not only that, if he forgets the word IBS, automatically he will not think about evacuating the content of the bowel immediately after. So mind plays a crucial role in most of the diseases, especially in IBS. I usually give the counseling for the patients suffering from IBS, especially people working in IT. They always have some stress. They are always on their tender hooks. Then always they think of the problem. So even during lunch, they are not having enough time to take proper lunch. Immediately after taking food, the person feels like going to the toilet. Then for such people, I always say, take up a project. When you are halfway through, stop that project. Then take food leisurely. When you are taking food leisurely, lunch leisurely, you will be thinking about the project which you have to finish immediately after lunch. By changing the emotion, by changing his mind, automatically the bowel it will be under his control. Stomach will be able to retain the food for a longer period. The evacuation will not be immediate. So counseling is immediately gives result. Not only that, for treatment purpose, he has got problem. By counseling alone, it is not going to solve the problem. But what is that we are supposed to do in case of irritable bowel syndrome? First, for removing the anxiety, go to the Agnya chakra. This is for this emotion. Then Manipura chakra has got the control over the stomach. For retaining the food for a longer period, optimum time, you go to the Manipura chakra. So malfunctioning of the Manipura chakra can be corrected by going to the Manipura chakra. Then Swadhisthana chakra, which has got control over the bowel. So if these two chakras are in harmony, irritable bowel syndrome can be totally eliminated. In case of Sujok acupuncture, you go to the mind by going to the brain. Brain is associated with the emotion called mind. Apply pressure here, concentrate only on the brain, automatically you feel the relaxation of the mind. Then go to the stomach. This is where the stomach is present. This is where the bowel is present. Treat the stomach, treat the bowel, automatically irritable bowel syndrome can be totally eliminated from your mind and also from the physical body. Simple solution for which sometimes they do not know what is the medicine that can be given. They pump steroids. There are some people who are coming to me, they were under steroids. After coming for this treatment, after combining Reiki and acupuncture, they got rid of steroids. It is very difficult for anybody to come out of the steroids. They go on pumping steroids, but it has got all side effects. So, if they do not know the cause, steroid is the only solution. But people suffering from IBS, most of the people are taking steroids. People who have come to me for IBS treatment, they got rid of IBS, they got rid of steroids also. Take simple treatment. What I am telling is, learn acupuncture or acupressure. It's in one day you can learn acupressure. All the organs are present here. You need not send the patient for X-ray, MRI, scanning, or blood sugar level, creatine level, urea level, all these things. Everything can be diagnosed here, everything can be treated. But only thing is, in one day you can treat, you can master the subject. Treat yourself, treat others also. This is why I am giving this type of video presentation also.